Hello, my name is Jenifer Benner, and this is preeclampsia monitoring and management, what you need to know. What are we talking about? We're talking about the prevention of emergency outcomes, including maternal and fetal mortality caused by lack of education on managing preeclampsia. Preeclampsia contributes to 15% of worldwide preterm births and 9 to 26% of all maternal deaths worldwide. Why are we talking about this? Because with proper education, patients can learn preventative measures and management techniques that will help ensure a positive pregnancy outcome. Why is this important to me? I have a personal experience with what can happen if preeclampsia is not controlled. I gave birth to my daughter, Susanna, she's in the picture on the right, on the first day of my 33rd week of pregnancy. She weighed only 3 pounds, 4 ounces, and spent a month in the NICU. I also know many mothers who have similar stories. Why is this significant? Because preeclampsia occurs in 4% of pregnancies, with 10% of those cases occurring prior to 34 weeks. Based on data from the United States National Hospital Discharge Survey, the prevalence of preeclampsia during admission for labor and delivery has increased by 25% just between 1987 and 2004. The objectives of this teaching are to learn the signs and symptoms of preeclampsia, the importance of blood pressure monitoring, the symptoms that require you to contact your healthcare provider, the symptoms that are emergent and require immediate medical care, how to properly take a self-blood pressure, and the prevention and maintenance orders that may be placed by your doctor. The trans-theoretical theory of change will be used in this preeclampsia education. It has 5 different stages. The first is pre-contemplation. In this stage, you were uninformed and unaware that education was needed because you were unaware of your risk for preeclampsia. The second phase is contemplation. In this stage, you're now informed of the disease process and are contemplating change. The third stage is preparation. In this stage, education and information will be given to you by the healthcare team so that you can get the tools necessary to monitor and manage the disease. Fourth stage is the action stage. This is the stage where you take the education provided prior to discharge and you use it in your daily life. The maintenance stage is the 5th stage. It is in this stage that you're being continually monitored by yourself and your medical staff. Orders that may or may not be placed by your doctor to help manage and prevent preeclampsia include medications such as low-dose aspirin or vitamin D, daily lifestyle changes including limited activity or even bed rest, blood pressure monitoring, low sodium diet, stress reduction. The signs and symptoms of preeclampsia include new onset hypertension, a systolic blood pressure of 144 or a diastolic blood pressure of 90, proteinuria, protein in your urine. It's not seen in all cases, but it is seen in most. Edema, swelling of your extremities. Once again, not always seen, but seen in most cases. What are the symptoms that need to be reported to your healthcare provider? Symptoms of high blood pressure, which include nervousness or an increased feeling of anxiety. Generally, if you feel that something's wrong, It probably is. Swelling or edema of your extremities. Facial flushing. Feeling hot in your face. A headache that's not controlled using over-the-counter medications such as acetaminophen, otherwise known as Tylenol. The following are the symptoms of severe preeclampsia and require immediate medical attention. Blurred vision or other vision changes. A blood pressure of 160 over 110 or higher. Altered mental status, such as confusion. A headache that is the worst headache of your life. Severe right upper abdominal pain. Decreased urine output. If you haven't gone pee in the past 8 to 10 hours, it's time to go to the hospital. Bluish discoloration to the skin, otherwise known as cyanosis. If your fingertips and toes start turning blue, you're not getting enough oxygen, and it's time to go to the hospital. A stroke or a seizure. How to properly take a self-blood pressure. Sit and rest for a few minutes. Extend your arm on a flat surface so that it's supported and ensure your feet are flat on the floor. Place the cuff approximately 1 inch above your elbow, wrapping it firmly. Ensure the cuff is the right size. If it's too big or too small, your readings may not be true. If you have an automatic blood pressure cuff, follow its instructions on how to inflate the cuff, then write down the date, time, arm used, and blood pressure on your blood pressure monitoring chart given to you at discharge. If you have a manual blood pressure cuff, you will need to manually pump it up using the bulb. Pump the bulb watching the number on the screen until the arrow points to a little above your previous blood pressure. Place your stethoscope over your artery in the crook of your elbow and listen as you slowly release the air in the cuff. When you first hear a beat, that is your systolic number, the top number of your blood pressure. When you hear the last beat, that is your diastolic number, the bottom number of your blood pressure. Record your blood pressure on your chart with date and time and arm used. Do not check your blood pressure if you have smoked, drank coffee or other caffeine, or exercised in the last 30 minutes, because that will skew your results. Nursing diagnosis and interventions. Risk for injury related to signs of preeclampsia, evidenced by elevated blood pressure with no previous history and protein in your urine. The goal is that you will be able to maintain pregnancy to 37 weeks of gestation after proper education and treatment with no serious complications to you or the baby. The interventions include the healthcare provider reviewing all warning signs and symptoms of preeclampsia to ensure that you have an understanding of the disease process and the management. Also, we will teach you and your family how to monitor for the clinical signs of preeclampsia and when to report the symptoms that indicate a worsening condition. The second nursing diagnosis is ineffective tissue perforation, related to severe preeclampsia, secondary to severe hypertension, evidenced by new onset hypertension. The goal is to prevent ineffective tissue perforation through education and medication. Intervention. The healthcare provider will establish baseline data, weight, edema, blood pressure, to use as a basis for evaluating effective treatments. Your healthcare provider will also monitor your intake and output, your blood pressure and weight, to assess for increased tissue perforation. The third nursing diagnosis is knowledge deficit. Lack of knowledge secondary to lack of education. When you arrived, you were unaware of which symptoms indicated preeclampsia or severe preeclampsia. The goal is that we will be able to educate you and give you the knowledge to prevent, monitor, and manage your disease process. Interventions will include giving you assigned education and ensuring that you and your family know how to properly take a blood pressure and how to monitor for symptoms of increased blood pressure, as well as taking a post-test prior to discharge on preeclampsia management, prevention, and monitoring. Outcomes. Our goals are that you will be able to demonstrate an understanding of the new information. You will be able to demonstrate how to properly take a self-blood pressure and be able to explain the importance of blood pressure monitoring, and that you will be able to explain how to monitor and control your condition in your daily life using the information we've provided. Practice question 1. The sequence for taking a proper blood pressure for daily monitoring is A. Take it at a different time every day, take it on the same arm, make a fist as a machine pumps up, and write down your results. B. Take it at the same time every day, on the same arm, relax your arm, and write down your results. C. Take it whenever you have time, take it on the same arm, relax your arm, and write down your results. D. Take it at the same time every day, on the opposite arm as the day before, keep your arm elevated, and write down your results. The correct answer is B. Take it at the same time every day, on the same arm, relax your arm, and write down your results. Practice number 2. Which of the following are symptoms used to diagnose preeclampsia? Systolic blood pressure greater than or equal to 140 on 2 occasions at least 4 hours apart. Diastolic blood pressure greater than or equal to 90 on 2 occasions at least 4 hours apart. Protein in your urine greater than or equal to 0.3 grams in a 24-hour specimen. Patient without protein in your urine, but instead with a new onset of double the normal liver enzymes, serum creatinine greater than 1.1, platelet count less than 100,000, pulmonary edema, cerebral symptoms, or visual changes. Or E, all of the above. The correct answer is E, all of the above. Practice number 3. What are considered severe preeclampsia features? A. New onset cerebral or visual disturbances. B. Severe persistent right upper quadrant or epigastric pain that is unresponsive to medications. C. Severe blood pressure elevations. D. Thrombocytopenia. E. Pulmonary edema. F. Progressive renal insufficiency. G. Protein in your urine. Or H. All but G. The correct answer is H. All but G. Practice question number 4. What symptoms would indicate a need to contact your practitioner and be seen as soon as possible? Severe headache that will not go away, bloating, severe right quadrant or epigastric pain, blood pressure above systolic of 160 or diastolic of 110 while on bed rest, or E, A, C, and D. The correct answer is E, A, C, and D. At this time, think of any questions you may have and write them down so that you can ask your nurse the next time she's in the room. Thank you for watching my presentation, and I hope you have a great day.